right. So this video is meant to help you prepare for that exciting first interview, that first nursing interview that you have been just waiting eagerly for years now. This is your time and you should prep for it accordingly, right? Whether you're on your own watching this video for some helpful tips and tricks on how to successfully land that first job that you want, how to research for that first job, or if you're joining in because it's required of your course. Either way, this will be a valuable experience for you. So let's start off. You're getting ready for your profession. You're getting ready essentially for the rest of your life here. And you're about to start your professional career, whether any nursing career, CNA, LPN, RN, FNP, doesn't matter. You're starting your career in the nursing profession. And with that comes certain poise and etiquette, right? So let's begin here. In this presentation, right? Let's talk about it. You're going to your first interview as a new grad nurse. Super exciting, super nerve-wracking time, right? I remember. So what are you supposed to do? How do you prepare for this? Well, we got to make a plan. We need to be strategic in our planning, right? We got to stay focused on the career day. Career day, like I said, could be in class, or it could be you've assigned yourself a personal day where you're ready to essentially take on the world, right? You're going to go to the interview and you're going to do awesome with preparation, of course. Stay focused, plan your day, dress to impress that professional who has been planning and has been studying to interview you. Certain people, HR specialists, right? This is what they go to school for. They go to school to interview people, to pick out personalities that are going to best coincide with the facility. They're going to pick out people who match the mission and vision of their facility, right? Because they have full buy-in. In order to be taken as a professional, you must dress as one. You must speak as one. You must look as one because you are one, right? Suggestion, definitely not required, of course. You should be researching where you want to work at. Once you land the interview and you get that phone call, text, email, whatever communication that they give to you, a good tip is to drive to the place the day before, a couple days before your interview, and see where you're supposed to park, see where the main entrance is, right? So that way, one, you know the commute time that it's going to take to get there. You're not going to be fumbling around looking for the main entrance. Make sure you get the name of the person who you're interviewing with, right? That's super important. Know what department that they're in, what floor that they're on. All those little things matter so you're not fumbling around trying to find them and then make yourself late, even though you were already on time, right? What does on time really mean? That means 10 to 15 minutes early, right? At least bare minimum 5 minutes early. That shows them that you've planned, that you're participating in the event that's scheduled and you're ready, and shows what type of worker you are. They don't want nurses or nursing professionals or healthcare workers to be late, right? Because then our relief has to wait for us, quite literally. Be mindful of your verbal and non-verbal cues. Let me see if I move this box out of the way, right? The person or persons you may be interviewing with, you may be one-on-one with an interviewer, a recruiter. You may be one-on-one, excuse me, you may be one-on-one at first, right? And then all of a sudden they fling you into a panel interview with several nursing professionals. What happens is they may sit you in the middle, and then around them will be floor managers, and they're looking for the best employee for them, the best candidate. So honestly, when you walk out of that room after you've thanked them, they're probably going to argue who wants you first, That's normally what happens. A panel interview can be very, very nerve-wracking, but don't let it be. Don't let it be. Go in there prepared. If you know what's to be in front of you, you're going to be better qualified to handle it, right? And don't freak out if somebody is younger or older than you and they're interviewing you. Age doesn't matter, right? It doesn't matter. You may be somebody's supervisor one day. You just don't know. So again, please don't focus on the age of who's interviewing you. Don't let it intimidate you. Watch your facial expressions. You want to smile at every opportunity possible while you're talking, but don't make it look fake. Like, thank you, right? Yeah. Thank you. Oh, and think about your answer, right? Think about when they ask you a question, take a second, process it, and then answer that. Okay. Um, Try not to fidget. Don't be fidgeting all around, shaking, get that leg going, right? Watch your eye movements. I was reading some articles, and quite interestingly, they say people who look up and to the right or to the left have shifty movements are fabricating. Now that's an assumption, but I just wanted to throw that in there. Just be mindful of your ocular movements. Right, resume time. A resume doesn't not define who you are. It's just a way of them painting a picture on where you've been and where you want to go. Okay. So it's a short and sweet way to highlight job history and where you're hoping that this professional career will take you, because that's what it is, a profession. Keep it between 1 and 2 pages. They want to see that hopefully you've worked somewhere, and if not, that's okay too. Put down volunteering, right? If you've helped in a skills lab on your own time in college or in nursing school, put that down. If you volunteered at a animal shelter or anywhere, put down volunteering. If you were a candy striper in the past, volunteer at a hospital, put it down. It looks good. Put down what languages you're fluent in. Put down what languages that you're certified in. There's a difference. Okay, I'm fluent in Spanish, but I am not certified in Spanish to explain medical terminology. We must get an interpreter for that. Don't be put in a weird position by some of your peers if you speak another language. Make sure if you're going to speak another language, I suggest to be certified, because the certification means something. Okay. If you have no job history, that's okay. Like I said, where'd you go to school? Clinical hours, clinical sites, how many hours you put into clinicals? Did you volunteer at a skills lab? Right? Think about all those things. If you have no work history, that's okay. If you do have a work history, put it down. Put it down on black and white. They want to see, they're looking for longevity. Doesn't necessarily have to be related. Every people start second careers all the time, and that's quite all right. That's the path most of us have been down. So you put down what is from your work history, including the best you can remember of dates, or at least months and years, right? So that's something that you want to include in your work history. Put down an objective. This is about 3 sentences or less where you want to see yourself in 2 years. They're saying, hey, if I hire this person, are they going to stick it out? Is this where they want to be? Is it worth me investing into this person? Right? So put down an objective and gear it towards the facility or your career. Some questions that you can ask the interviewer, is there room for advancement up the ladder? Right? Because we don't want lateral movement, we want upward movements. Try to think in an APA already. APA font, meaning new Times New Roman or New Times Roman, font 12. You can, of course, you can go bigger for the capitalization areas that you'll need, like job history, education level, and you need to put down your highest level of education completed. If you are a student, for example, if you have, let's say, an ADN degree and you're a registered nurse, but you've now enrolled in a BSN program or RN to BSN or what have you, could be RN to MSN, whatever you're enrolled in, you can put that down as an active enrolled student where you're going and your anticipated graduation date. That tells them, hey, you know what, this person, they're in school, but they're making it work and it's pertinent. So do we want this person who's going to get a bachelor's of nursing in the next 2 years? Absolutely, right? Certain hospitals around this area give you 3 years to get your BSN while working for them. And then some places even give you a bonus and a raise. So lots of good things. They can help you pay for it, tuition reimbursement. Those could be some of your questions. Um, Include your name with credentials, your address, your cell phone number, a professional email. I put an example in here. Don't be putting down that bad kitty, whatever, whatever. Don't do it, right? Do something professional. Try to get away from revealing your birthday in an email. Keep it professional. You can think about it. Look up some examples on them. You can do, for example, first name, initial, dot, full last name, or just maybe 4 letters of your last name, and maybe a credential, RN. Something creative, something unique but professional, limiting that personal aspect of it, because even though they don't discriminate, um, well, certain things just don't set a correct precedence. Okay, so just be mindful of your email you're choosing. Um, and avoid using a photo on your resume because you want to negate any type of um, negative opinions that could be associated with your photo. We don't know what people are thinking. We don't know what people's experience in the past have been. So minus the photo, right? Let them get you there. Let them meet you. Let them see you. Get that first impression. All right. Here we go. Some attire notes. Make sure that you're not showing your cleavage, tattoos. Reduce the amount of piercings to an acceptable number. Um, it's that, and again, this is not required, but this is highly suggested. Remove facial piercings. Be mindful of your undergarments. Do not wear a white blouse and a pink cheetah bra underneath of it. It's just not going to give a good first impression, right? You may look like you just came off the, anyway, I'm not going to go there. Wear appropriate footwear. Be prepared for a hospital tour or a facility tour, and walking around with 6-inch stilettos is just not going to work. Okay. Don't wear sandals or flip-flops to a meeting. It should be business formal. Okay. Ladies, a wedge, a pump, or a heel 2 inches or less is suggested. Normally a 1.5 inch is pretty good, or a 1 inch. It says that I'm prepared, I'm professional, and I came ready for this job. Okay. Remember, gentlemen, make sure you're clean shaven. Of course, mindful of piercings and tattoos. I have piercings and tattoos, but you wouldn't know that unless I shared it and showed it to you. Okay. We don't have to air our business out during the interview time. Okay. Um, give a good firm handshake. You know, don't kill their hand, but a good firm, confident handshake, right? Old school. Throw it back a bit. Shows confidence. Colors, right? Make sure it looks appropriate on you. Wear some neutral colors. Okay, those are always a good idea. And this is not just for my opinion. I've talked to different recruiters in the area, and they prefer neutral instead of loud, bright colors. Okay. Wear a blazer if possible. You know, the jacket, like a suit jacket, a blazer, both for male and female, doesn't matter what gender. A blazer just really ties in the business aspect of the purpose of why you're there. A job interview. All right, I'll move myself out of the way here. Cell phones and portfolios. What am I to do with my cell phone keys too? Am I gonna tuck it in or clip it to my belt loop and let it jingle jangle all around? No, No, skip that for today. You can do that when you're going to a tailgating party, but not for a professional role, right? If you choose to bring a cell phone, because we all have families, try to hide it in your main portfolio or in your pocket. If your attire has one, keep it on silent. If you choose to wear a smartwatch, just be mindful of the alerts. Set it to silent mode. That's best. At least you can still see if your kids are home, what's going on with them, right? Everything okay? Alerts. Um, Being prepared with the main portfolio is key. What I mean by a main portfolio is it's a fancy binder that you'll keep career document copies of, like your nursing license, a copy of your driver's license, a copy of your social security card, a copy of your BLS, a copy of ACLS if you have it, any copies of letters of recommendations, copies of CVs, curriculum vitae, or resumes. An even added tool, you can put a voided copy of a blank check or any copies of certifications, um, a copy of your most recent degree, an unofficial transcript copy, and a black pen, right? That's your main one. Or you can keep all the originals in there if you like, but I highly suggest copies in case you lose it. And then you want to be prepared with some giveaway portfolios. I'll show you what I mean by that. So this is an example of a main portfolio and what I call a giveaway portfolio. And I kind of just deemed these myself here. A main portfolio you can find online. Amazon sells them for about 45 or less. And what it is, it's like a leather portfolio. Target has them, Walmart has them. Target has some nice ones, but it has a binder aspect to it. So you can actually put these in sleeve protectors, right? You can put and make it look nice. This is your main area that you're working in professionally. You can keep copies of everything in here. And of course, you want to have a black pen because that's a legal color for signing documents. Hopefully a nice job offer, maybe even a sign-on bonus, not as a new grad, but as maybe an experienced nurse or whatever the offer is. Some places are, no matter what, offering sign-on bonuses. So you need a good pen. It shows that you came prepared. You also want to, before you go to your interview, you want to write down some questions you may have for them. Do you do tuition reimbursement? What's my room for advancement? Right? Where's the you? This is a big question, probably not a good one, but you can ask, where's the company headed in the next 5 years? What's your initiatives, or what initiatives do you have on the floor right now? How can I prepare myself to be on the floor? Because you want to pretend that you already have the job. It shows confidence, right? In this portfolio right here, the main one, you can see there's places to hide your cell phone. You can hide a tablet in here too. You can hide your keys. So all you're doing that day is walking in with one portfolio. You don't have to get a big one like this. You can get a skinny one. Doesn't matter. Okay. Um, so again, the main portfolio is something you keep with you, you build on. And the giveaways, those are like inexpensive report covers. You get them at the dollar store. I used to find them in Staples for about 55 cents, and I would make at least two. And I'd have copies of all that information I just discussed on a copy of a resume. Again, because you're assuming that you're getting the job for good reason. You want to show confidence. And when they ask you, hey, do you have a copy of your social so you can fill out an I-9 or a W-4 or whatever federal paperwork they're going to have you fill out for employment, you're set. You can start onboarding immediately, because we all know how long onboarding takes, right? You get those ready, they're going to be like, wow, I have personally utilized this tactic and they love it. They love it. I've had nothing but positive feedback. So I'd like to share that to you. All right. Um, Making that first impression, go in there, be happy. You're here, you've graduated, you've passed the NCLEX, you're in front of them, right? They need you. Okay. Be confident. Be prepared to answer the interview questions, because this is a time where you don't get a second chance at a first impression. Okay, so what else? What else can we do? How can we prepare? You may be asked in the past how you've de-escalated an issue or how you've overcome interprofessional issues. They may ask you what's your 2 to 5 year plan, where you see yourself. Make sure you research where you're going to interview. Don't just, go on a popular job website and apply to anything. You are unique. You are skilled. You are educated. You are trained. Research the company that you're applying for. Make sure you know their mission and vision and how you can benefit their organization. Okay. So some key takeaways from this video, right? Communication is key. You need a solid resume. You got to look professional. Mind your verbal and nonverbal cues, your body language. Stay positive, focused. Get a good night's sleep the night before. Don't forget to research where you're interviewing at, because you may think you're interviewing at a facility and then all of a sudden you're interviewing in a satellite office. Make sure you know where to go. Okay. And that way, if you go to the place before the interview, right, like a day or two before, and you're like, okay, wait a second, there's construction here. I need to give myself an extra 20 minutes or I'm going to be late. That's what a prudent nurse would do. And make your portfolios. I can't say it enough. A lot of people, some people have some negative tones, say, no one ever looks at portfolios. I tell you what, from experience, they do. Okay. They do. How about, this is a good one. Do I bring a purse? Well, if you decide to create the main portfolio, there's really no need for a purse because everything you're going to have will be hidden in the main portfolio. It'll have all the pertinent employment documents already there. If you still decide to bring a purse, make sure you're not bringing the giant purse in, the one that looks like a beach bag. Bring something nice and slim. Something that's not going to have a bunch of keychains, jingle jangle everywhere. Something minimalist, okay? In a minimalist fashion. Men, you can still bring your wallet because that hides in a pocket really good. But women, sometimes we don't have a lot of pockets to place things in. It becomes cumbersome. So just be mindful. Dress up the day before and see how it's going to work for you. You need to be prepared that day because if you get hired on the spot, you're going to take your badge photo. So be mindful and make sure you're ready for a nice picture. So here's where I call you to action. Think now where you want to be in 2 years. Come to terms with the fact that you may need support during the transition to a professional nursing role. What do I mean by that? If you're a new grad nurse, you're going to need support, and that's okay. You want support. You don't want to just be thrown onto a floor or a unit that you're unfamiliar with. You want to make sure that you can join a program while you're hired, a training program. Some places call it a residency program. Some places have other names for it, but wherever you decide to go, one of your interview questions is, what support do you offer me as a new grad nurse? Do you offer X amount of weeks to train on the unit? Is it a specialty unit? What type of training will you get if you go to a specialty unit? How will you get the option to choose what unit you want to work in? Maybe you're a new RN and you want to work in L&D. That's the time to ask right now what floor they plan to put you on, because you are hopeful for an L&D position or an ER position. And that's when you'll have a separate conversation with that recruiter right on the spot. So make sure you're prepared with professional jargon, professional language, nursing jargon, right? Make sure you know what they're going to tell you. Don't forget, lastly, a thank you. Thank you for your time, a sincere thank you. Don't tear up and walk out because either you're excited or super nervous. Look them in the eye, each one of them, and say, you know what? Thank them all. If it's a panel interview, thank them all for your time. Thanks for your consideration. It was a pleasure being here. I hope to see you soon, right? Lead and leave with grace, right? Poise, confidence. Don't leave with your tail tucked between your legs. You're going to leave confidently. You are a trained and educated nurse. Whether you're a new grad nurse or a seasoned nurse trying to transition into a different type of care, lead with grace and confidence. All right, I'll leave you to it. Head to preparing those documents and hopefully landing that job that you've been dying to get since you were in nursing school. Thanks again.